Welcome to HCA Talks Health, brought to you by Health Coaches Academy, the UK's leading health coach training academy. I'm your host, Zena Le Roux, a certified health coach, and each fortnight I'm joined by experts from across the health and well-being space to share insights, ideas, and practical tips you can use to improve your health and everyday well-being. With me today is Dr. Mark Morningstar. He specializes in scoliosis rehabilitation, integrative medicine, chiropractic neurology, and comprehensive spine care. He's the president of the International Chiropractic Scoliosis Board, with his career almost exclusively dedicated to patients with scoliosis. Welcome, Mark. It's lovely to have you.
Thank you very much for having me.
Why scoliosis? Why does it matter to you? Tell us more, please, Mark.
Yeah.
Yeah,
Good question. So fair question. So I would say, I don't have any really cool personal story like I have scoliosis myself or something
yeah.
that I overcame or whatever. But having said that, very early in my practice career, what became sort of, I would suppose, very frustrating for me was that I would keep seeing patients due to problems they were having that I would call self-inflicted, like, poor lifestyle decisions, that kind of poor habits, that kind of thing. And the real sort of frustrating part about it was that they didn't want to have any skin in the game. It was like, all right, I'm coming to you, doc. I want you to fix me.
Yeah.
They didn't want to take ownership of the problem. They didn't want to do all of the stuff that they had to do at home. They would rather just come in over and over and over. And at some point, it's the definition of insanity, right? Do the same thing over and over, expect a different result. So it honestly, it just got very where I almost sort of had this like ethical dilemma.
Mm,
And it's just like, what am I even helping these people
mm,
when really I'm just really offering them the equivalent of a Motrin, or just a temporary Band-Aid. So, um, I almost got to a point where I almost just quit practice because I felt like I really wasn't. I got into this to help people, and I didn't really feel like I was helping them,
yeah.
and I was somehow letting them down in my own mind.
Mm,
Well, along the way, in my geographic area, the closest orthopedic surgeon is about an hour drive away. And so I started having some of these patients bring their children in to see me who had been recently diagnosed by their pediatrician with a curve. And, maybe it was going to be a few weeks before they got to see ortho, or maybe they went to the ortho and the ortho said, we're not going to do anything, but just kind of watch and wait. And no parent really was comfortable with doing nothing.
mm,
So they would bring their children in. Well, it became very evident right away that scoliosis, unlike maybe what their parents were being seen for, scoliosis is not a self-inflicted problem. Scoliosis is, these kids are literally a victim of their circumstance,
yeah.
and they didn't ask for this. This is not a bad lifestyle thing, anything like that. And so it became much more rewarding to help kids for a problem that they didn't ask for in that sense.
Mm,
And then on the other hand, even though, despite the fact that maybe mom or dad would never do what I asked them to do at home, come hell or high water, they were going to make sure their child did what I asked them to do because they were going to be over the top of them, making sure it got done.
yeah.
And lo and behold, when that started happening, we started seeing curves improve and kids' lives change. And everybody was kind of like, holy cow, my child puts this work in at home and we're actually getting results. And this is even verified by the surgeon that, my child's curve is improving. So at
Ah,
that point, I just kind of turned the corner in my practice and said, this is really all I want to do.
uh-huh.
And that was, gosh, probably 20 years ago now, somewhere in that range.
Oh, lovely. So
And I haven't looked back.
what you're saying is that there is actually a lot that you can do with
Absolutely. There's
and
a ton
manage
you can do.
scoliosis. Mm,
Absolutely. Absolutely. So, I mean, and the problem is, at least, of course, here in the States, and it's not really that different in most of the rest of the world, is that when we talk about the management of scoliosis as a condition, it's typically spearheaded by an orthopedic surgeon.
mm,
And which is good in a sense that obviously at the end of the day, if a curvature reaches a point where surgery is necessary, you want a surgeon, spearheading it. However, only a minority of children are ever going to reach a threshold where the surgeon becomes necessary.
mm.
And so, what about the rest of the kids who, yeah, maybe their curves don't hit a surgery level, but when they're still children, but if you don't do anything to properly manage the curve, that curve is going to continue to slowly worsen across the lifespan and
Mm.
now cause problems when they're not 14 anymore, but now they're 40.
Mm.
And yet, because they're 40, they're not going to see that same pediatric orthopedic surgeon anymore. They're going to see somebody different who's more along the lines of pain management. And
Mm-hmm.
so they're not really trying to positively impact the condition structurally. They're just trying to manage the symptoms associated with it.
Yeah. Okay.
And so the whole system for most of the non-pediatric surgery cases is entirely flawed.
Uh-huh. Okay, so I think the question on everyone's lips is, what can you do? How do you what's a root cause approach to scoliosis? What does that look like? What do you ask
Sure.
these patients to go do at home?
Sure. Well, like I mentioned at the beginning, when a parent takes their child, let's say a child has a 15-degree curve. Classically, they're going to go to an orthopedic surgeon. The orthopedic surgeon just say, well, it's only 15 degrees. It's a very mild case. We're not going to do anything right now.
Mm.
We're just going to take an x-ray every 6 months to see if it gets worse. There isn't a single parent out there that I have ever spoken with who has said that they were comfortable with that option.
Yeah.
No parent wants to do nothing.
Mm-mm.
It's just they're not really given any alternative treatment or management strategies for that.
Mm.
And so while a lot of people tend to just focus on the curve, I think some of the biggest things are that there has been information out there published, going on 40 years, which, it's not new information at this point, and it's certainly not information published by me, that shows that scoliosis has very specific undertones that directly caused that curve to happen during a time of active growth. Like, for example, 90% of girls with scoliosis have a chronic underlying hormone problem attached to their curve.
Interesting.
In fact, just 2 years ago, because statistically about 80% of kids with scoliosis have a chronic digestive disturbance of some type, right? So, and in fact, so much so that a couple of years ago, there was a study published in the journal Children where they actually created the term functional gastrointestinal disorders in scoliosis
Mm-hmm.
because they have sort of this group of non-specific symptoms that is, any single one of them might not be its own diagnosis per se,
Yeah.
but they just have these collection of abnormal symptoms, sort of kind of vague, diffuse symptoms that seem to be plaguing kids with a curve far more often than other kids.
Yeah.
And of course, we also know, and it's really pretty much accepted as self-evident at this point, that there's a big genetic component to scoliosis.
Mm.
Well, if we know that scoliosis has a genetic component, or meaning more appropriately, genomic risk or predisposition, why aren't we trying to do things to mitigate that risk?
Mm.
So, as easy examples, there are. I published a study here a couple of years ago with a couple of pharmacists showing that children with the MTHFR and COMT gene variants, their curves were far more likely to progress 20 degrees or more from the time of diagnosis till the time they were done growing versus people who had neither of those or only had one or the other.
Mm.
So, depending on your genetic risks, that can have a huge impact.
Mm.
But if you know that and you identify that early, and you can do different functional medicine kinds of strategies to ameliorate the impact of those genetic variants, well, maybe now they're not as impactful on curve progression or maybe even curve occurrence altogether if you catch it or if you
Mm.
catch the child early enough.
Yeah. Yeah.
But yet again, those are all things that nobody talks about because everybody just gets so honed in on what's the curve measurement. And
Yeah.
I understand that because again, 50 degrees is the marker, at least here in the States, for a surgery threshold.
Yeah.
And so everybody gets hung up on that.
So you're saying that it's important to work with these kids while they're still growing and not wait until they're 40 and have to do pain management or include pain management strategies. So is is it only relevant to kids or can you also support people in their 40s or is it really too
Oh,
late?
oh no, we see probably as many, if not more, adults now, ironically, than we do kids for the same
Okay.
reason. I mean, for this same pathway. But the
Mm.
problem is, of course, now is adults are coming in because now they've had their curve for so long and it has insidiously progressed for so long that now they're having a lot of intractable pain and symptoms because of it.
Mm.
And but yet the problem or the neglect, I suppose, is probably the most accurate way to say it, is, if we knew that that 40-year-old had that curve since they were a teenager, well, all of those other things that cause that or trigger that curve to happen in the first place don't just magically go away because they became an adult.
Mm.
So they still have the same underlying hormone disruptions, GI complaints, genetic risks, all of these things that still continue to impact that curve across the lifespan that you still have to do something about. Otherwise, whatever I'm doing to physically treat the curve is not going to have as good of a chance at creating a permanent benefit.
Okay. Yeah, I hear you. Okay, so the digestive issues and the hormonal complaints or disruptions is causing, are you saying it's actually causing the curve to yeah, be the way it is?
Nobody will go out on a limb 100% and say that, but yes, I
Yeah.
believe that it does happen that way. And they are very, very interrelated.
Okay. So part of, I mean, you treat the spine in a certain way as a chiropractor, but then also
Sure.
you recommend they rely on some functional medicine strategies as well to treat the digestive and the hormonal side of things as well. Is that kind of the
Yeah,
bigger
yeah,
picture that you
absolutely.
look
I
at?
mean, I think from treating the curve specifically,
Yeah.
there are a lot of very, very effective scoliosis specific physiotherapy methods out there, a
Yeah.
lot of which I use myself, right? So it's not a matter of it's not a question of whether exercises work because it's already been well established that exercises can and do help the curve.
Mm.
The only missing piece for most every physical method out there is, are you doing all the workup to eliminate the triggers of this curve in the first place?
Mm.
Or even if they weren't the triggers that caused the curve at the start, there's still going to be triggers for curve progression, not only as an adolescent, but through the adult lifespan as well.
Okay.
I mean, when you think about it, scoliosis, there are three stages in life where the curve tends to progress a little bit more rapidly
Yeah.
or start. You have puberty, you have pregnancy, and then perimenopause,
Oh.
right? I call them the three P's. Well, what's the common thread among all of those? Those are periods of time of rapid hormone change.
Mm. Yeah.
And so it's logical that hormone disruptions and hormone problems can be one of the big triggers for a curve to either start or accelerate.
Okay. Yeah. So are there any other triggers? You said eliminating triggers. Are you thinking mainly hormonal stuff, or is there anything else that people can avoid or prevent by doing everyday stuff, lifestyle things?
Yeah, absolutely. Well, I think in a lot of cases, um, is hormones are a very big component of it for sure, but also we get into a lot of neurotransmitter status as well. And I think that's ultimately where a lot of the GI factors come in, is because most of our neurotransmitters, no matter which one you're talking about, are either created or activated or absorbed in the gut first.
Mm.
And so if you don't have normal gut function, it's almost impossible to have normal neurotransmitter production and output.
Mm-hmm.
And so we do a lot of neurotransmitter testing to see, okay, for example, it's been known forever that serotonin and melatonin are part and parcel to scoliosis onset. But again, nobody really ever does anything about it. And interestingly, there was again another study done in the same journal, Children, by three orthopedic surgeons in Romania here, and this was just 2 or 3 years ago, where they took a whole group of kids, young adolescents with mild curves, newly diagnosed, where they would classically be in that watch and wait kind of protocol, right? And so they took the whole group of kids, split them into two subgroups, and had one group continue to just do nothing, do the watch and wait. And then the other half of the kids took three nutrients, and that's it. They took calcium, vitamin D, and melatonin. And in that group, their curves did not progress nearly as frequently or as severely as the kids who did nothing.
Wow. Wow.
And just taking nutrients, right? I mean, it's not even like they did a whole lot. So, it's the whole, ounce of prevention, pound of cure kind of a thing. So,
Hmm.
and that's all it gets, and taking those nutrients gets to the root causes of why curves can accelerate.
Mm.
Because even in kids, we talk about vitamin D and calcium. kids with scoliosis are known to have lesser bone density than their peers.
Mm.
And there are different reasons for that.
And I think it makes sense the fact that there's digestive complaints as well. So they're probably not able to absorb the nutrients in the same way
Sure.
some house
100%.
might. Yeah.
Yeah, 100%.
Very interesting. So you've mentioned earlier that you were quite frustrated when practicing as a chiropractor because bad lifestyle habits were leading to back issues. So,
Sure.
you know, we had a bit of a discussion around that just now, but thinking about some of the things that we can do to prevent pain and back issues. But I'm thinking, so besides scoliosis, just thinking about back health in general, what
Yeah.
are some of the typical stuff that you consider as a bad lifestyle habit that impacts the back directly?
Sure, sure, absolutely. I think two things in general that I really try to harp on all of my patients about. One of them is just regular daily physical activity. I mean, we've gotten to a point where as a world, we are just too sedentary.
Mm.
It's not like, when I was a kid, I was, climbing trees and, out in the yard until the street lights came on at nighttime. And, I mean, we didn't stop moving all day long. And we have lack of physical activity, and it doesn't even have to be a ton. It's like I tell my patients, just do a little, a lot.
Mm.
If you just think of it that way,
Mm.
put your work in for your body, it will pay you in huge dividends.
Mm.
So lack of physical activity is one thing. The other thing is we eat diets that are far too pro-inflammatory.
Mm.
Whether it be, practically every third person is insulin resistant and every third person is estrogen dominant and all of these things that are so pro-inflammatory. And a lot of it is self-inflicted.
Mm.
We're eating and drinking out of plastics. We're being exposed to plastics. We're eating meat that's injected with all kinds of hormones. We're exposed to all kinds of EMR.
Mm.
There are just so many stressors to the body that people weren't exposed to even 30 years ago.
Mm.
That's just causing everybody to break down. But nobody wants to, pay attention to any of that.
Mm.
And nobody wants to do the things it takes to reverse insulin resistance, for example, or they don't want to eat an anti-inflammatory diet because that's not very tasty.
Yeah. Yeah, exactly. So are you finding that there's starting to come a bit of a shift with this? You've mentioned earlier that people don't want to go and do the things that they need to do. Just come and fix me, doctor. You know, it's an easier approach. Do you think that perhaps there is a bit of a shift taking place of people wanting to take matters into their own hand and wanting to be part of the healing journey themselves, or not so much?
Sure. I think I can't speak for the whole world, but at least I noticed that in my location mainly. And I don't think it's anything that they necessarily want to do. I
Mm.
think, like most things, necessity is the mother of all action.
Mm.
And here in the United States, with how much health insurance costs are, people are having medical bills in general that are becoming so expensive that their insurances won't cover, or they have a $10 million deductible they'd have to pay before their insurance even pays for anything. So now that people are starting to actually have to pay for more things out of pocket,
Yeah.
they're being much more selective in what they're doing, and they're paying much more attention to, okay, what got me to this point? So if nothing else, yeah, my health is one thing, but how can I save on my pocketbook?
Mm. Exactly.
And maybe that's a misguided objective, but at least it's still getting us to the same endpoint, which is they're being much more selective on how they're approaching this now and seeing it for what it is. And I think even with a lot of the COVID stuff that has happened, I think that has awakened a lot of people to saying, no, wait, look, we now have all these young kids who are dying from blood clots and heart attacks. And I mean, what's going on here, right? And so I think it seems like every generation or two, we all have these experiences that we have to go through in order to have an awakening, from a health perspective to say, okay, hey, look, maybe we do need to change some things up.
Mm. Yes, exactly. Have you ever wondered whether you could turn your interest in health and wellness into a meaningful career? At Health Coaches Academy, we train people just like you to become professional health and wellness coaches through our Level 5 diploma. It's a 12-month part-time course, fully accredited, and designed to give you the skills, confidence, and practical knowledge to help others transform their health while building a career you love. If this sounds like something you'd like to explore, visit healthcoachesacademy.com. Now, back to the show. It's some of these things are simple, but it's maybe not always that easy to
Right.
implement and to do them every single day. But you've mentioned a few things now. So the things that people can take, the matters that they can take into their own hands is to do a lot. So just move your body as often as possible and eat the anti-inflammatory foods to reduce that overall low-grade inflammation in the body. Um, and then what would you recommend around hormones? Do they need to get it tested? And gut health, are there specific protocols that you recommend, or is it kind of a general checkup?
Well, I wouldn't say it's a general checkup, but we do a lot of testing. We do a lot of gut and hormone testing,
Okay.
mainly because we try to make it very individualized.
Okay.
And again, from my perspective as well, it's not always just about, I have a lot of colleagues who do a lot of, in fact, our medical director here does a lot of bioidentical hormone replacement.
Yeah.
But that doesn't mean everybody needs bioidentical. Even though I think they're a lot better than conventional hormone replacement, that doesn't mean everybody needs that. I
Yeah.
mean, especially if I'm dealing in scoliosis with children, for example, and they have hormone problems, I'm not going to put a 14-year-old on hormones.
Yeah.
That's just
Yeah.
antithetical to a natural person, right? So, but what I want to do is I want to help them do the things that encourage their own body to produce those hormones in the ratios that they're supposed to be.
Yeah.
And so there's a lot of precursor enzyme kinds of things that we can do to reestablish normal hormone balance.
Okay. Okay.
And same thing gut wise. I mean, it might be something where maybe for a short term you have to avoid a certain few different minimal thing food wise, just because now your immune system is reactive to them or something.
Mm.
But you still have to reestablish, okay, why is your gut barrier broken down? Why are you not absorbing? What does your stomach acid look like? What is your gut bacteria? I mean, anybody in this space, these are all kind of basic concepts, but
Mm.
the problem is these should be like the first line of defense, no matter what kind of health practitioner you are.
Yeah. And it's multidimensional, so it's not just looking at one issue and trying to treat the symptoms. It's really looking at the bigger picture and the whole patient, and all the body systems that are included and that might be causing and adding to the problem. So I mean, there's of course there's lots of interesting research on the gut X axis, the axes. There's so many things that the gut links to, and I've even seen the gut bone axis recently, and interesting research on that as well. So yeah, it just shows you it's multidimensional, and that's where the integrative care comes in as well. We need to look at how the different body systems affect the organs and the spine and everything. So yeah, very important work that you're doing. So I know that you don't have scoliosis yourself, but do you in your own life implement some of these strategies like the activity and the anti-inflammatory food and just making sure your gut is healthy? Is that something you do in your own life as well?
Yeah, I'm a big fan of testing and doing all the same things I would recommend for any patient.
Yeah.
I have my own hobbies. I do martial arts. I do things to try to keep moving and stay healthy myself. I mean, you go in our kitchen and we have a whole kitchen cabinet full of supplements, and we do all of the things that we tell our patients to do. We eat as clean as possible. We don't eat out. We don't, as a family, I have 4 kids, my wife and I. So, we try to, we're trying to impart upon them, look, there's a way that you can do this that still tastes good, but you can
Yeah,
still eat clean. You
exactly.
can eat clean and have it be very fulfilling in terms of palate. And then that way you're much less likely to have issues down the line.
Yeah,
And
exactly. Yeah, so you're absolutely practicing what you're preaching, and you can experience the difference in your own life and in your family's life as well.
Absolutely.
If someone's listening today and perhaps they do have scoliosis at whatever age range they're at, what would you want them to know? What do you want to leave them with today? What are some of the practical things they can maybe do?
Sure. Well, I think first and foremost, I think there are some sort of misnomers or myths out there that a lot of people either have been told or maybe they believe. One of them being adults are told that once you're done growing, what you have is what you have.
Uh,
If you have a curve that's, 30 degrees when you're an adult, when you're skeletally mature, what you have is what you have. You can't make it better, and it's going to stay that way the rest of your life.
mm,
That is utter nonsense.
mm,
It will get worse if you don't do something about it, and you can do something to improve it.
yeah.
And that's not even just my opinion. There are a number of research studies out there in adult scoliosis patients showing that there are scoliosis specific exercises that can improve curves in adult patients.
Mm,
So that's just, fallacy number one.
mm,
And then the same thing in children where they'll be told that children with minor curves, because only a small minority of them, about 20% of them will go on to need surgery, that their likelihood is that they don't need treatment, which is why the watch and wait period even exists.
mm,
But again, no parent wants to have that. It's like, you know what? I don't necessarily want to have insurance on my automobile, but I do in case something happens
yeah. Yeah.
or my house or whatever else, right? So I would much rather do something to be proactive. And I think most parents agree with that. It's just they're never given that as an option. And those options exist.
Mm. Yeah, exactly. So it's interesting that many of these strategies that you've mentioned, they are all evidence-based. You're saying that there's really good research out there to support it. Um, but why do you think that it's not common knowledge yet?
Well, I think there are a lot of things. I would say the glass half full side of me
Yeah,
says that, if let's say I'm an orthopedic surgeon, right? At the end of the day, like I mentioned, I'm being paid to do surgery and I'm being paid to manage a surgery threshold case,
yeah.
really. So as a surgeon who's trying to keep up, I have a whole lot of research that gets published every day, frankly, but at least every month, right? If I want to try to stay current on research, there's enough research just in my own field that I have to try to stay current on as far as surgery techniques, surgery procedures, that kind of thing, infection care.
Mm.
So all of this stuff constantly evolves. Well, it doesn't behoove me as a surgeon to necessarily keep up on non-surgical scoliosis treatment
Yeah,
because that's not what I'm doing.
no.
Now, there are a number of orthos that might recommend bracing or Schroth or some other kinds of conservative therapies, but they're not really recommending them from a position of true knowledge of those things.
Yeah.
Just what they've been told they can refer for because that person is not yet a surgery case.
Mm. Mm.
So to me, I think that's why a lot of people have sort of been hesitant to take up conservative therapies is because again, when ortho is the one dictating what you're doing,
Mm.
most people are going to take their ortho's recommendations to heart and either say, oh, well, you don't need to do anything because it's not bad enough.
Yeah.
And
Yeah.
so a lot of parents, even though they don't like that option, they have no reason to distrust their surgeon because the surgeon might fully think that there's nothing else out there for them because that's, at the end, we're all a product of our own knowledge and our training background.
Yeah.
And so I think that is one big facet to it. And again, on the pessimistic side, I hate to say it, but there, at least in the States where we have an insurance fee for service model of care, why, if I'm a surgeon, especially if I'm an employee of a hospital system, and I'm being paid millions of dollars a year to perform scoliosis surgery by this hospital, it doesn't help me to provide conservative recommendations that are effective because for every case that where a brace or exercises work, that child is no longer a surgery case, meaning the hospital now just collected $10,000 on a bracing protocol and missed out on $200,000 on a surgery.
Mm.
And that's an uncomfortable conversation that people don't like to have, but it's still the truth.
Mm.
Healthcare is still a business at the end of the day. And there are direct financial incentives to make sure that conservative treatments either don't succeed or are not recommended altogether.
Mm. Do you think that there are cases when someone do need surgery or pain meds, or would the conservative treatment always have an impact?
100%. So first and foremost, I wouldn't ever say that I'm against the surgery because
Yeah,
the surgery has its place.
yeah,
It's just I prefer to have patients go into the surgery eyes wide open and knowing what it's doing, right? So for me, I'm more likely to recommend somebody to consider surgery as an option if they're having a true medical reason to have the surgery.
okay.
So for example, in scoliosis, that's typically going to be a heart or a lung impact.
Mm,
Well, that heart or lung impact could happen at 60 degrees, but it might not happen until it's 90 or 100 degrees.
mm,
And if there isn't an established medical reason to have the surgery, the reality is the surgery is only being done for a cosmetic purpose.
mm, mm.
And if you're doing that, because again, that's not to demean the value of physical appearance at all,
Yeah.
but at least know that that's why you're doing it.
Mm,
Because what's happening is if you have a traditional fusion scoliosis surgery, you are trading a mobile, functional, curved spine for a very straight but much less functional one.
ah,
And that's not without its consequences in the longer term.
of course not. Yeah.
It's like I tell people sort of tongue in cheek, realize that you are either becoming or turning your child into a human telephone pole.
Yeah,
And yes, you're going to look straight on an x-ray, and that curve is going to look a lot better, but it comes with a trade-off.
yeah, of course.
And
Okay.
so to me, as long as they know that, if they still want to have that, well, hey, that's their body. They have every right to make that decision. I don't begrudge them that.
Mm,
But for the people out there who really want to know when is the most optimal time, I would say, if I have a child who comes in and says, you know what, I'm really noticing that my stamina during football is not what I think it should be for my age. I'm in shape, I work hard, I train, but my endurance is just really impacted. Well, now we can send that patient for pulmonary function testing. And if all of a sudden it comes back that their lung capacity is half of what it should be because they have a big curve, well, at least now we've established a medical reason to have that surgery.
yeah. Okay. Mm.
And now we have tangible evidence of that.
What are some of the other symptoms that people might be experiencing besides, aesthetics or pain, perhaps? How else would they know that scoliosis might be at play?
Well, that's the hard part is until scoliosis reaches a certain minimum sort of critical threshold, it's very difficult to even notice it posturally because the body tends to kind of hide it really well.
Okay.
It's very well documented that we get a lot of false negatives because if I'm just doing the old Adams, forward bending test and kind of, look at the rib cage and the spine, there are many cases where the curve is already 25 to 30 degrees before it starts to show up on that kind of a postural, observation.
Mm.
And especially nowadays to me with how ultra low dose all digital x-ray machines are now. I mean, heck, most people get less radiation on a scoliosis X, far less radiation exposure on a scoliosis X-ray than they do on an airline flight, for
Yeah.
crying out loud. And nobody has any reservation about flying. So,
True.
to me, why, if you suspect at all that your child might have a curve, to me, you're far better off just going and getting an X-ray done
Mm.
to just see it tangibly. Do I have a 14-degree curve or not? Because it's much easier to fix a 14-degree curve than to do nothing and wait for it to hit 35.
Mm.
And now you're not going to be able to get it all the way down to nothing.
Yeah. So if that is the case for someone listening today, and I mean they can't come to your office for you to support them, are you saying that some of these things you've mentioned today is a good starting point? Start with
Absolutely. Yeah.
that, check your
I
hormones.
think, yeah,
Mm.
no matter who they're saying. I mean, you can even go, I mean, depending on where you're at, most people can still find whoever their primary care provider is,
Yeah.
or maybe their child's pediatrician, and effectively just say, look, I want an x-ray.
Yeah.
And
Yeah.
I think as long as parents push, at least that's been my experience, that most pediatricians won't fight them on it if a parent really wants and pushes for the x-ray.
Yeah. Okay. Okay, and if someone listening today want to reach out to you or they want to find out more, what are the avenues that they can use to do that?
Sure, sure, absolutely. So my own personal practice is just scoliosispractice.com.
Okay.
Um, We also have a network of doctors throughout the United States called Back Genius.
Mm-hmm.
And they're all doctors, like-minded like myself. And we have there are chiropractors, physical therapists, and even osteopathic physicians who are all in the Back Genius network. But we all do the same kind of comprehensive, non-surgery therapies. And when it's somebody who can't get to my geographic location, we have people all over who are still at least going to provide the same kind of care.
Brilliant. Fantastic. Thank you. Thank you so much, Mark. If there's one thing that you can leave our listeners with today, what would that be?
I would say you're always better. And again, I'm saying this not just as a provider, but as a dad, because I have a daughter with cerebral palsy, right? And I am always of the opinion as her dad that if she has a problem with something, and obviously she does, I'm more than apt to throw the kitchen sink at the problem. As a dad, I want to have no regrets and leave no stone unturned that I didn't do everything I possibly could to help my daughter.
Yes.
And I think every parent inherently feels that way. And I just want them to know that these things exist and are out there, and they don't have to accept doing nothing.
No. Yeah, love that. Very powerful. So there's always something that we can do, and make sure that you left no stone unturned, to
Absolutely.
support your kids, but also yourself. So yeah,
Absolutely.
and it's important. I think it's important overall to take care of our backs. It's such a central part of who we are. And it's very encouraging to know that there's so much that we can do before considering medication or even surgery. So thank you, Mark. Thank you so much for joining us. Thank you for listening. We hope you enjoyed this episode. Please feel free to share it with friends or family who might find it inspiring. And if you'd like more insights like this sent directly to your inbox, make sure to sign up for our fortnightly HCA Talks Health newsletter. We've popped the link in the show notes. See you next time.